Welcome to our training session on workplace violence prevention. Training objectives. Understand the definition and types of workplace violence. Recognize the signs and triggers of workplace violence. Identify the roles and responsibilities of both employers and employees in maintaining a safe work environment. Learn strategies to prevent violence and manage conflicts effectively. Understand the importance of timely reporting, confidentiality, and intervention. What is workplace violence? Any act or threat of physical violence, harassment, intimidation, or disruptive behavior. This can involve employees, individuals, or visitors. Examples: threats, intimidation, sabotage, vandalism, or bringing weapons onto company premises. Workplace violence can range from verbal threats to physical harm, disrupting productivity and morale. Why is workplace violence a serious issue? Leads to physical injuries, mental health issues, workplace stress, absenteeism, and turnover. Contributes to a toxic work environment, low morale, and decreased productivity. The emotional toll on employees and long-term impacts on the organization's culture are significant. Types of workplace violence. Physical, hitting, pushing, using weapons. Verbal, yelling, threats, insults. Psychological, bullying, gossip, intimidation. All types can cause lasting harm, affecting both individuals and the overall work environment. Common types of harassment includes racial and gender discrimination, inappropriate jokes, bullying, and favoritism. Unaddressed harassment can escalate into violence, leading to increased stress and disengagement. Immediate action is necessary to maintain a respectful and productive workplace. Workplace violence statistics. Over 2 million incidents of workplace violence are reported annually in the U.S. Healthcare, home care, and social services experience higher rates of workplace violence. Understanding the prevalence of workplace violence helps prioritize its prevention and response. Triggers of workplace violence. Organizational factors: job overload, poor policies, understaffing, lack of leadership. Personal factors: job loss, financial problems, domestic issues. Work-related and personal factors both contribute to stress and conflict. Heightening the risk of violence. Causes of workplace violence. Long working hours, workplace stress, poor communication, and lack of leadership. Risk factors for direct support professionals, DSPs, client interactions, difficult home environments, long hours. A combination of work conditions and personal stressors increases the potential for violent behavior. Indicators of workplace conflict. Behavioral signs: mood swings, aggression, substance abuse, defensiveness. Physical signs: bruises, strained interactions, noticeable discomfort among employees. Identifying early signs of conflict can prevent escalation and promote early intervention. Physical versus psychological violence. Physical assaults such as hitting, pushing, or using weapons. Psychological: bullying, emotional manipulation, or undermining trust. Both types can cause long-lasting harm, affecting the emotional and physical well-being of employees. Employer responsibilities. Legal duty: employers must create a safe and nonviolent work environment. Preventive measures: implement clear policies, conduct threat assessments, and collaborate with law enforcement when needed. Employers must ensure that all staff are aware of safety protocols and equipped to handle potential threats. Employee responsibilities. Employees must report violent, harassing, or intimidating behavior immediately. Take all threats seriously and follow safety protocols. Employees play a key role in maintaining a safe workplace by staying vigilant and communicating concerns. OneWell Healthcare's Violence Prevention Plan. Zero tolerance for violence, even in jest. Employees must report threats or incidents to supervisors immediately. Investigations, all reports are reviewed promptly, with appropriate actions taken. OneWell Healthcare is committed to maintaining a violence-free workplace. Corrective action and discipline. Disciplinary measures for workplace violence may include warnings, suspension, or termination. If violence involves non-employees, corrective action may include legal measures. The goal is to prevent recurrence and maintain a safe working environment for everyone. Reporting and response procedures. Reporting tools, anonymous hotlines, direct communication with HR, supervisor escalation points. Response protocol, immediate reporting, thorough documentation, witness interviews, and timely intervention. Reporting ensures that all incidents are addressed swiftly and appropriately. Importance of timely intervention. Quick intervention reduces the potential for further escalation. It helps protect employees and minimizes the emotional impact of violence. Effective response strategies require timely action and clear communication channels. Confidentiality and retaliation protection. All reports of workplace violence are confidential to the greatest extent possible. Retaliation against employees who report violence is strictly prohibited. Ensuring confidentiality and protection from retaliation encourages employees to speak up without fear of consequences. Post-incident actions. Medical evaluation, provide immediate medical treatment and trauma-informed care to employees. Investigation, thorough investigation of the incident with witness interviews and documentation. Recovery. Offer stress debriefing sessions and counseling services to help employees recover from traumatic events. Communication strategies for prevention. Key strategies: active listening, transparent communication, regular team meetings, and open dialogue. Encourage employees to share concerns and suggestions. Regular communication helps identify potential issues early and prevents them from escalating. Conclusion and commitment to safety. OneWell Healthcare is committed to creating a respectful, safe, and productive environment for all employees. Everyone plays a part in preventing violence and maintaining a safe workplace. Final note. Your vigilance, adherence to safety protocols, and open communication are essential to a positive and secure work environment. Thank you for watching the Workplace Violence Prevention module. Please answer the questions for this training before moving on to the next training module.